later.
Bye.
All right. There you go, Senator Frank Blas Jr., the real public safety committee chairman. Because as you guys may recall, the actual public safety chair, Senator Peter Zerlahi, is so conflicted by issues involving his family members that he just simply can't do the job of public safety chair, which again is just so egregious because not only do the men and women in blue deserve someone who can give their full attention to all of the issues that are going on with the Guam Police Department, but the people of Guam as well deserve someone who can tackle these problems and hopefully try and solve them with a full-time job, right? So anyway, 9:22, it is what it is. Let's head over to, well, let's stay in the KUAM News Zoom room, where, again, Sabrina is live from the Cosmopolitan Hotel in beautiful downtown Las Vegas. Jill and Chima, not Las Vegas. Where are you guys at?
We're in the office.
There you go. Right here on Guam.
And beautiful downtown again. Yeah.
There you go.
Yeah.
I was going to say that's a really nice living room you have there, Sabrina.
I know, right? She must have got her stimulus.
So Sabrina, I didn't see.
You see that picture of that lady?
Yeah, we've been looking at it all morning.
I should probably change the shot. Oh, sorry.
Yeah, it was kind of funny when you're doing the news and there's like a booty over your right shoulder.
Why did you tell me?
Because it's boosting ratings. Fine. All right.
Where is that? Your house or office? Or is it?
No, it's a hotel room.
She's in Las Vegas, Chima.
61st floor of the
She's celebrating Pride Month.
Wow.
Okay. Our quarantine looks better than the hotel.
Let's get right into it. Enough joking around. This is serious business right here. Public health. We have the Chief Public Health Officer, Chima Mbakwe, and, of course, the spokesperson for the Department of Public Health and Social Services, Janela Carrera. Janela, we'll go ahead and start with you because we know there's a lot of outreach going on here with public health, right?
That's right. Yeah. So, yeah, you're right. We do have a lot of outreach almost daily that, we're so busy. We just added Micronesia Mall to our roles, our list. So we've got Micronesia Mall every Thursday and Friday now. So that starts this week. So actually starting tomorrow, Micronesia Mall, Center Court, and then I believe that's in the morning, and then moving to the afternoon, we go up to the second floor. But today we're at the Farmers Co-op, and then we also are at Estumbo Senior Center tomorrow as well. So we've got several options for people to get vaccinated, and we've also got testing also happening as well. So there's really no excuse for anyone to get vaccinated or tested. I was listening to Crystal Paco San Agustin this morning when they were, they didn't announce who the winners were, but, they were talking about the vaccine win for the $10,000 prize and the car incentive. And, she said, if you haven't gotten vaccinated yet, what are you waiting for? So, I want to echo her sentiments on that. So, the full list, you can find it on DPHSS, our website, dphss.guam.gov/vaccinategu for where you can get vaccinated. But the central location obviously is UOG Fieldhouse. That's Tuesday through Saturday. Otherwise, we're pretty much all over the place. We've got our Northern Region Community Health Center, our Southern Region Community Health Center, Micronesia Mall, Estumbo Senior Center. We've got the Farmers Co-op Market, Micronesia Mall, as I mentioned. And then I know that AMC, GRNC, and GHRA also have vaccination clinics ongoing during the week also. So, they've also been great partners in doing community outreach as well. So, there's really no excuses, once again, if you haven't been vaccinated. Now, we also have a great incentive for people to get vaccinated as well. So those are our community outreach efforts happening. And then the other thing too is you may very well know, we made an announcement that we were awarded a $6.6 million CDC grant. So with that grant, we'll be increasing, beefing up our efforts to do community testing and contact tracing. So, and that's really to target our underserved and hard to reach communities. So we'll be able to do more outreach in the next 2 years for COVID-19.
Awesome. Good news. Just for clarification, are any of the clinics you were mentioning, are they combination COVID testing and vaccination clinics?
Yes.
Or are they all?
Today is actually drive-through testing and vaccination at the Farmers Co-op.
Okay.
That's from 9 to 1 p.m.
Okay. Can we talk about the variants?
Bree, you got to say it right. The variance. Variance of concern.
Alpha, beta, and delta.
Right. Yeah.
Yeah.
Go
Yeah,
ahead.
I'll turn over to Chima for that.
Right
I'll
on.
turn that over.
Chima, what can you tell us about the variance of concern?
They're here.
Yeah, for sure.
Yeah.
Okay. So I think it goes to show that what we've been doing over time is reflective of the results we're getting today. And the variance being here and then seeing our numbers so low means that public health is actually on top of it. And for all the good news is that for everyone who was identified as having this variant has actually completed quarantine, all of them. And that being said, the interventions that we have in place actually work for us. The main variant of concern, which is the P1, the Japan-Brazil variant, did not escape or did not get into the community because this was a travel-related case that was identified in the government quarantine facility. The individual was not vaccinated, and then the individual was transferred from the government quarantine facility to the government isolation facility, which is the Bayview. And another interesting thing is that this individual is unvaccinated, and with our new guidance on fully vaccinated individuals coming into Guam and going home straight. With this individual not being fully vaccinated, we were able to also use the existing public health guidance to transfer them to the government quarantine facility and then test them in the 6 days that they were supposed to be there, and then they turned positive. So I think with the variants, knowing that they're here and knowing that we have the capacity, to contain it using our strategies is good news. Right. I don't know how to say it, but I think it's good to know that we can handle it. And then for the community cases too, we were able to identify the individuals on time. We were able to quarantine them, and we did not see much spread of this variant, considering the number of results tests we've sent for genome sequencing. So I think we're doing good.
Chima, I don't know. I mean, forgive me if this sounds weird, but we get these news of these variants, and then when we look at, the positives that we have and the spread, it's almost like when I look at it, does it even matter that we had the variants? Because like you said, it just kind of seems like, well, we handle it.
So what it is here is, so you're looking at the public health interventions, which is the quarantine and isolation, right? So, and the testing that is going on at the same time, and then immunization. So there's a good balance with what interventions we have in place now. So we're able to quarantine the individuals that are exposed to these positive cases, completely isolate them from the community, test them before they complete quarantine, and at the same time, we're encouraging people to go get vaccinated. So while we're working towards protecting the community, at the same time, we're doing active case finding for new infections. Then we also have those processes in place. When they are identified, they are adequately mitigated. So it goes to show how well we're doing at this point in relation to some other places around us. But the implication is, how much longer are we going to be like this? So that is now the question, are people going to continue doing what we're doing?
Yeah.
What are the next steps, to continue, being at this level? How do we open up our island? How do we open up our schools? How do we, how do people interact? So this is now what we're going to look at, how do we maintain this good record?
Right.
So that's where we're going to. And one of those things is everyone getting vaccinated.
So Chima, let me just ask you this, like mathematically speaking, right? If we have how many people vaccinated?
Over 87,000.
Right, over 87,000 people. So just mathematically speaking, are we, is the chance of there being another big surge, is it mathematically less likely than it was a year ago? Because it kind of seems like, right, if the fully vaccinated people are immune or whatever to the virus, and we're still vaccinating people, are there enough unvaccinated people left for there to be a big surge where we see, 50 positives, 60 positives?
50 positives in one day?
Yeah, I'm just saying, is there any chance we can go back to that surge given that we've got so many people who are vaccinated and we're quickly approaching the herd immunity?
The situation is pretty unpredictable, but with what we have in place, we can say the chances of us getting back to where we are is not possible at this point, considering the way we are moving. But like I said, it is how do we keep the pace, how do we remain consistent in what we're doing to keep us here? So it's gotten to that level where we've gotten to a level where we need to sustain. So what are those structures that we have in place for us to sustain what we've achieved? What policies, what behavior change practices do we have in place for us to maintain the level that we are now? So that is it. But going back to where we are is if we don't continue the way we're going forward. And looking at the community at the moment, there are chances that we will not get back to where we are before because people are more positive and more receptive and have accepted these changes. There are a few onesies and twosies, people who are still challenging public health, for personal reasons, but we have a huge number of people who are really adhering, and that is the result you see today.
I wanted to add too, I think, going back to your question, Chris, when you mentioned, does it even matter? I think it really does matter because it highlights our work. And going back to Chima's comment, is that, without the public health interventions, the government of Guam interventions, the rate of spread might have been greater. Right. And so public health with all the partners that we have, federal and local partners, we've gotten into this sort of rhythm. In the last 18 months, we've learned a lot. And so we've gotten sort of into this rhythm with all the interventions that we have. And we've learned a lot of lessons. But with the interventions, following all the guidelines, the CDC guidelines, and all the, the public health interventions that we use, all these tools, all the policies, all the protocols that we've used is really the work that we put into it is what how we've been able to contain the spread, even with these different variants that we're seeing in the community as well. Some of them, a lot of them are community spread. And the fact that we have a very high rate of vaccination here in Guam compared to the rest of the U.S. That goes to show, and it really is the reason why we've been able to contain, the spread and not see another surge of COVID-19 in our community.
Don't get me wrong. I didn't mean necessarily that it doesn't matter. I'm just saying that had we gotten this news a year ago, I would have freaked the hell out and not come to work and just lock myself in the, in the house, right? But now it's like Okay, so we have the variance, but we aren't seeing the correlation with the increase in hospitalizations and deaths, and that's what I meant. But I wanted to switch gears a little bit. Can you give us an update on the guidance for the AirBNB? Because I know that there's a lot of moving parts in GVB really pushing for this, but they're waiting on the guidance. So is there a holdup? And if so, what is it?
No, there's no. So we just have a role to play in the AirBNB, and we're meeting today. I think we have a meeting by 11 o'clock today to continue the discussion. So GVB is leading the effort, and we are just supporting and giving technical guidance where they need technical guidance.
Okay. Go ahead, Chris. Did you want to follow up on that?
Well, I had another question on a different matter, but if you want to expand on the Airbnb, go for it. I can wait.
No, I don't. I wanted to ask about, is there any discussions regarding like mandatory vaccinations, say, for example, for GDOE, for students that want to go back to face-to-face? Because, I mean, it's TB vaccinations are required. I didn't know if, like, you guys are talking about, well, let's require COVID vaccinations.
So that discussion came up this morning, and it is something we can explore. But you you can actually do as much as you can without legislation, right? So we're looking at what the future holds for COVID, and looking at what the reasons why we should mandate people to get vaccinated. So it's on the table. There's so much on the table, for us now moving forward, because like I said, at the beginning of this, I think a lot of people did not understand what role public health was playing. They didn't understand how much effort we put into every guidance that we bring out, every recommendation that we made. People came out, with all those CDC said, WHO said, and we kept telling them that, yes, we know those facts before they are published because we work directly with these people. But what we tend to forget is that every community is different. Every scenario is different. But if you are looking at how to make policies or recommendations based on your own peculiarities, you have to put a lot into the process. So what we're doing today at Public Health, which is for me a good thing, with the guidance of the director, understanding clearly that while we are in this fight today, we also have other fight in front of us. We also have to manage other situations that might arise from this particular fight. So he has a team, that he works with daily, to look at scenarios that are existing now, scenarios that might be forthcoming, for us to have those structures and plans in place. So the mandatory vaccination has come up on the table, but there's a lot, behind it. There have to be litigation issues. There has to be legislative issues behind it. So these are thoughts that are on the table, but the process is what, but it's a good idea, to mandate vaccine at some point for some people who deal maybe with the vulnerable population, like for TB. If you work in the hospital, you're made to do your annual TB test, because you're dealing with people who are sick, and the chances are that if you infect them, they might get sicker, or something could happen to them. So it's just that we're looking at those scenarios, and down the line we might come up with recommendations, because basically we can't mandate without any legislative or legal authority.
Chima, I wanted to go back to the Airbnb because we hear from GVB that they're waiting for public health. But you said that you're only providing technical assistance. So is there another part of public health that's working on these Airbnb protocols, or is GVB just misinformed?
No, so when we provide technical guidance, so they write their SOPs, they have the plan. The AirBNB is not a public health driven program. It's a GVB driven program that we're working in partnership with them. So we're contributing a section to what they're doing, and that is part of what we're going to discuss today. They gave us They gave us documents to review. They asked us about our input in some areas that public health, has to be. Public health can be involved in marketing. We don't have that capacity. So our capacity is, on mitigation, quarantine guidance, exposure guidance, which is what we're working with them. So we're contributing our part, and we're meeting today by 11 o'clock.
Okay. Sorry, Bree. Real quick. So there's supposed to be a senior citizen
Helping Hands adult
daycare. They were supposed to open yesterday, but we heard that they weren't allowed to open because public health is supposed to come out with new guidance or something. Do you have any information on that?
None for now.
Janella?
I don't have any information on that. The only thing that I can say is that, at least for public health and the senior centers, we have not been able, or we have not opened or given any green light for senior centers to open because of the ongoing COVID-19 pandemic. But it is on the table. It is being discussed, the possibility of reopening them in partnership with the Mayor's Council. But I have not heard anything about that private business. I can follow up and get back to you on that. I'm aware of that private business, the adult daycare, but I wasn't aware of them not being allowed to open.
Yeah, I mean, it was sad because they had all the Monomco out there to check it out, and then I guess for whatever reason, they weren't allowed to open, and everyone had to go home with a sad face.
I see. Okay, yeah, I can definitely follow up on that. And as I mentioned, our own, adult daycare centers are not even open yet.
Still closed, correct. Yeah.
Right.
Bree, anything before we close them down?
No. That's I was actually going to ask him about that.
Okay, got it. Chima, I like your flag back there. Way to support Pride Month.
Thank you.
Right on. Janella, thank you. Maybe we could.
Thanks, guys.
I wanted to ask. Maybe we can get Malou on later this week about the honey walnut roaches.
Oh. Yes, if not Malou, because as she
she's
revealed
retiring.
She's retiring.
You're right. Yeah. Okay.
Maybe we can have Tom Nadeau back on.
Yeah.
Tom.
Or that young kid that you guys had. There was a young guy you brought on one time. Remember?
Oh yes, Jerome.
Jerome. Yeah. Tell Jerome we're still waiting for our rat video.
Miss Tita. Yes.
Yeah.
Okay.
Thank you, Chima. Thank you, Janella.
All right.
All right, guys.
Bye.
Later. There you go. There you go. Hey, we're going to take a break. 9:45. It's Wednesday. The show is proudly brought to you by Pacific Points. Go make it a point. You'll make it a